We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Cleveland Clinic Mercy Hospital and Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at the BHPC and our listening audience continued good health. In the studio with me is Brad White, a compounding pharmacist and vice president of Medicine Center Pharmacy. If you are following us on Facebook this week, we are expecting our guest to be Dr. Rishi Goel from Altman Neurosurgery. Dr. Goel was called into emergency surgery this morning, so Brad and I are going to share our top 10 tips for wellness.
Good morning, everyone. When most people think of a pharmacist, they think of that friendly professional in a lab coat behind a tall pharmacy counter counting pills and putting them in a bottle. At the Medicine Center Pharmacy, the job of a pharmacist isn't just about filling prescriptions. It's about helping people live healthier lives. Pharmacists coordinate all of your medications from your doctors as a single point of coordination on your healthcare team. And best of all, they're available to talk to you anytime, no appointment necessary. Most of the time, we think about being well as avoiding colds and the flu so we can go about our normal lives. During the last year or so, though, we've been focused on staying healthy and avoiding the coronavirus. At the Medicine Center, our focus has always been our patients and their wellness. We will help you develop a plan to stay well, especially during this pandemic. Today, we want to share our top 10 tips to help you all stay healthy and live your best life and accomplish all those things that bring you joy. We'd like to remind our listeners that this program can be downloaded on our podcast. So if you pick up your smartphone and your favorite podcast app, just look for Health Matters with the Medicine Center Pharmacy and please subscribe to our program.
So, friends, I'd like to start this morning by repeating some exciting news. First, it's the 10th anniversary of our Health Matters show, which is amazing. We couldn't be more thankful that you tune in and share this time with us. In addition, our Medicine Center pharmacies have been voted best of the best pharmacies for the third consecutive year by readers of the Canton Repository, and we are nominated for Good Neighbors Pharmacy of the Year. We are proud to be your pharmacy and thankful to all of those who voted for us, so thank you for your continued support. As Brad mentioned earlier, staying well is a priority, and like all priorities, it requires a plan or strategy to successfully fulfill that priority. This morning, we would like to share our top 10 tips for staying well. Our first tip is get vaccinated. You can't turn on the news today without listening to a story about COVID vaccinations, and our number one tip is stay immunized. Not just the COVID vaccine, but all recommended vaccines. So, Brad, can you tell our listeners about the immunizations we currently offer and if they can get multiple vaccinations at one time?
I can. So first off, one of the things that happened about the middle of last year during the COVID pandemic was that many health departments and the CDC were concerned because a lot of children in particular were missing regularly scheduled appointments with their doctors, and therefore they were missing their regularly scheduled preventative vaccinations. So that has come up, hopefully, and been a situation where we're starting to recover from that. But, one of the things that happen when you don't see your primary care doctor on a regular basis is those routine checkups, if you will, whether it be your car or your body, are important. So, as far as vaccinations go, it's always important to have those regularly scheduled vaccines. In the pharmacy, you probably think of us more for flu vaccinations and pneumonia vaccinations and shingles vaccinations. But more and more, we've been offering patients vaccinations like Tdap and hepatitis and meningococcal vaccines And before the pandemic, we were even offering travel vaccines. So those are all available. It's all going to depend on which vaccine you need, depending on if you're trying to get a COVID vaccine at the same time. A little tidbit for everyone at this point in time, there are still COVID vaccines available in the community from the local health departments and the local hospitals. We hope to know more information about the Johnson & Johnson vaccine later today based on the CDC guidance. So one thing that you need to know is that there are some vaccinations you cannot get at the same time, but there are vaccinations that you can get at the same time. So you need to talk to us at the Medicine Center about what you need to get, and we can make the determination based on the guidance of the literature, what is appropriate and what needs to be spaced out. So that's a little beyond the scope of our discussion this morning, but it's an excellent question and conversation to have with one of our pharmacists.
So, it might be intimidating to our listeners to get a vaccine, or some of our listeners, or immunization during a pandemic. Can you address that concern and share how we are managing that concern at the Medicine Center pharmacies?
Yes. So one thing we've done is we've made it possible to schedule an appointment on our website, and that can help you reserve a time so that you can come in and have the best attention and be in and out in a timely fashion. You can always call the pharmacy and inquire about getting a vaccine, and we can make sure we have it ready for you when you come in. But a lot of patients have become used to being able to go online and schedule an appointment at a defined time, and so that's something that we've offered since last March. So it's been really well received. So patients can schedule in their day off and, the days and weeks to come if they need, if they need that pneumonia shot or they need that shingle shot, and it's been very convenient. So we work hard, too, to make sure we have clean and neat areas, and we can keep you separate from the other patients in the pharmacy. And that way we can make sure that social distancing is observed. And, of course, all of our staff is wearing masks and regularly cleaning frequently touched surfaces.
So how about, can you explain what know your numbers means and what lab tests we offer at Medicine Center Pharmacy?
Yeah, know your numbers is important. And when we think of know your numbers, I think as a pharmacist of everything from your blood pressure to your blood sugar, maybe your heart rate. Those are a couple things that are real important. A lot of times, too, since we live in the Midwest, we have a lot of patients in our community that have issues with thyroid disease. So a TSH is the gold standard for benchmark for monitoring the health of your thyroid gland. So some of the tests that we offer are also available on our website, and you can also schedule those right from there. It's super convenient. You just go to medshoprx.com. That's medshoprx.com, and you can schedule an appointment right there on the top menu bar. But we have a number of tests, so we can certainly take your blood pressure. We can do a glucose test to check your blood sugar. We can do a screening for the hemoglobin A1C, which is roughly a 3-month average of the blood sugar that you have had over the last 3 months. We can do TSH tests, which, again, tests for thyroid health. Those are our most popular ones, in addition to cholesterol levels. So cholesterol levels, we can do a total cholesterol, a lipid profile that has HDL and LDL, and it shows you a nice range of your overall general health. So we find a lot of patients asking us about these lab tests because with the development of more and more patients that have high deductible plans, this is something that really has become a challenge for patients to figure out how to make copays and lab visits and still get to the doctor. So if you have a question about a lab test, we offer them very affordably. Many of the tests are real time and you get the answer right in the pharmacy. We have a couple tests which we have to mail in for, but those are generally back in about 7 or 8 days. So if you're looking for a lab test for cholesterol or A1C or glucose or blood pressure or TSH, give us a buzz at the pharmacy and we'd be happy to help you out.
Okay, what about cost? How much do these lab tests cost?
So the lab tests range anywhere from $25 to $80, depending on what you get. The vitamin D test is the highest price test, but they're just an expensive test to run. But it's still considerably less than what you might pay at a lab for like a hospital or a LabCorp or a place like that. So generally, the most popular tests are a lipid profile, which are like $35. And an A1C is about $30, $35. So all those tests are very affordable. It's cheaper than a trip to the doctor. And I tell you, we've had a lot of providers that have been really happy patients can get those tests at the pharmacy in a cost-efficient manner because it helps the provider help the patient with guidance when funds are tight.
Okay, tip number 3, support your immune system. Brad, what supplements do you recommend?
Well, supplements are near and dear to my heart, and there's simple things you can do, very simple things. A multivitamin is probably the simplest thing you can do. And, we have, for years, we've recommended Dr. Linus Pauling's Super Multivitamin, and unfortunately, the company has decided to stop manufacturing those, and we're really disappointed because it was a great vitamin. The tablets were a nice size if you weren't into taking horse pills. And a simple multivitamin can reduce your risk of the common cold by 25% right off the bat. But, depending on your diet and your on-the-go lifestyle, it's a multivitamin is a simple thing you can do to supplement the basic needs that you have all around. So our recommendation now is a vitamin that comes from White's Premium. It's our own company line named after my father and I. It's guaranteed money back. It's a professional grade. It's in a capsule. So if you're not a capsule or a tablet swallowing fan, you can open it up and sprinkle it on your food. It's one a day. It comes 60 in a bottle, and so one bottle lasts 2 months. It's got a nice mix of 22 vitamins and minerals, and it's really a great vitamin. So I encourage you to check it out if you're looking for a vitamin to support your basic health. In addition, there's things that you can do. We have our own kids' vitamins too, and you know what? Our kids' vitamins are free. So the kids' vitamins, you can get a bottle free each month when you come in the pharmacy for kids grades K through 5. So if you're not on our kids' free vitamin program, stop in the medicine centers today and sign up, and we'd be happy to help improve the health of your little one. If you're looking for extra support, so since the pandemic started, I've been taking this Immunity Power. It's by BioSwiss. It's a beta-glucan product, and it's something that can help boost your immune system. We certainly need all the help we can get during the pandemic, and this product has beta-glucan and some vitamin D. You can't beat having some vitamin D every day. Even though we live in Ohio, we don't get a lot of sun, and one of those things is a challenge to make vitamin D for your body. So, vitamin D, a multivitamin, something like our Immunity Power are 3 really simple, basic things you can do today to start improving your health.
As Brad said, the children's vitamins are free. What's the age limit on it? 6? I forget what the age is.
It's kindergarten through grade 5. I have to admit, I don't remember how young they are in kindergarten, but they're chewable vitamins, so they're modeled after the Flintstone vitamins. So they've got a basic mix of nutrients. So as long as your child can chew up the vitamin and they're in kindergarten through grade 5, we'd be happy to help supply these for you.
And very important for the children because of the diets that we're all living with, what they're living with, that sort of thing. So I think we'll take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Hundreds of new items have arrived at the Half Off and Out By store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook. Everyone has been tuned in to where to get their COVID vaccine. We've been proud to serve the community in this process. The Medicine Center offers many other vaccines like shingles, influenza, pneumonia, Tdap, meningitis, MMR, hepatitis A and B, and travel vaccines. Do you need a vaccine? Give us a call at the pharmacy or visit our website at medshoprx.com to schedule your appointment. Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing our top 10 tips to stay healthy. So, number 4, limit exposure, or as you hear in the news, limit contacts. Staying away from others may be, that's not in the right sentence. Staying away from others who may be sick is important, and we to explain how easy we can make that for you.
Well, limit exposure, one of the things that's been really interesting, which I don't think we've seen a lot about on the news this past year, but this past season for flu was probably one of the lowest flu seasons on record in the recent history. And a lot of that, I think, is because people have been hyper-conscious on wearing masks, washing their hands frequently, and frequently disinfecting frequently touched surfaces. Even some of the big public companies that are in the pharmacy space with us in like the Medicine Center reported record lows in sales for cough and cold medicines. So if there was ever an example that washing your hands and being cognizant of who you have contact with makes a big difference with respect to when you are on or what kind of cold or flu or sickness you have, it was this year. I think as we all move forward, we will all be more cognizant of what we touch and who we interact with. But don't underestimate supporting your immune system with the supplements we mentioned before the commercial break. Making sure that you frequently wash your hands and wipe down your counters and doorknobs and things. All those things make a huge difference with what you pick up on any given day.
If you're like me, you have the best intentions when it comes to following your doctor's directions. But sometimes our memory plays tricks on us, and we think we took our medicine, but we didn't. Brad, how about telling us listeners about how to help that?
This is probably one of the most common questions we get in the pharmacy, and we have a number of ways to help. So the first thing we do is we assign patients a health coach at the Medicine Center. So if you take medications on a monthly basis, something for heart, blood pressure, diabetes, thyroid, even a birth control pill, we are happy to have you have a liaison at the pharmacy who can call you a couple days before your medication's due, go over your medication changes, make sure if you need refills, we can try to assist and get you those before you need your drug picked up. So that's one thing we do, the health coach. The other thing we can do is when you start to take more than 2 or 3 medications, it can really be a challenge. And you're trying to remember them, especially if you take one in the morning and one at lunch and one in the evening and maybe one before you go to bed. You know, everybody's busy, lots going on, whether it be running to work or taking care of grandchildren or watching your favorite TV show. Time can get away from you. So one of the really great tools we have is our Easy Dose Packs. They come in a box like this, and it's a strip roll, and they're really slick. Basically what we have is a packet that has your dose for the time period. So this particular packet is an 8 a.m. dose, and it's got a list of all the medications on the label, and you can see they're all packed in there. You tear this off, and you can take this with you wherever you go. You know, maybe you're going to work, maybe you're going to the store, but you can take that with you, put it in your purse, put it in your lunch bag, or just put it beside your chair in your house. And this is something that can really make sure that you keep track of the medication doses that you have. So if you still have your 8 o'clock a.m. packet in your strip and for the morning, then I forgot to take my 8 a.m. medication. So what you can do then is you can call us at the pharmacy and talk to the pharmacist and say, all right, it's 9:30. I missed my 8 a.m. dose. What do I do? Do I take them now or do I wait? So that's another tool that, you know, don't overlook pharmacists in helping you solve those problems that come up during the day. But these Easy Dose Packs have been a real lifesaver for a lot of patients, and we have hundreds of patients taking advantage of this every week. So if you'd like more information, give us a call at the pharmacy, or you can check out the Easy Dose Pack page on our website.
Okay, tip number 6 is manage your chronic conditions, whether it's high blood pressure, diabetes, cholesterol, or other conditions. Managing them to stay in line with your physician's comments and recommendations is critical. Brad, can you tell our listeners how we help our patients manage chronic conditions and make it as affordable as possible?
Well, I think when you say chronic conditions, the first thing I think of is diabetes and heart disease. So as far as making diabetes more affordable, one of the things that we have at the pharmacy is our Easy Dose Packs, our Easy Max meter. And this is a blood glucose monitor that is extremely affordable. This is a monitor that we have carried for almost 10 years now, I believe. It was designed by one of the premier electrical engineers that worked for a giant company of a brand name that we won't mention. But the great thing about this meter is it's very cost effective. It's highly accurate. It's got a nice big screen with big numbers on it that you can see. And if you'd like, it even talks to you. So we have this kit put together because one of the challenges sometimes is patients that have insurance through Medicare, they have to meet certain guidelines in Medicare's eyes before we can bill their prescription. So this kit was put together with the benefit of having everything wrapped up in it. You've got the meter, you've got test strips, you've got lancets, you've got a lancing device, and we've even thrown some glucose tabs in there to help get you started on the right foot for low blood sugar issues. So this is a kit we offer for free at the Medicine Center, one to a customer that has diabetes newly diagnosed. And the test strips are super affordable. And when we come back from the news, we'll talk about how affordable the test strips are. It's going to surprise you.
Bottom of the hour time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Out By store in Louisville, next to the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Do you have to test for blood glucose? We know test strips can be very expensive at many pharmacies. At the Medicine Center Pharmacies, we supply you with a free Easy Max kit, monitor, and strips to either continue or begin with a new blood glucose monitor. And when you buy a package of 50 strips, they're only $7.99. And only at the Medicine Center Pharmacies you'll find this bargain in Canton, Louisville, Minerva, and New Philadelphia. See us on Facebook for more healthcare bargains.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
We are back to Health Matters with Brad and Paul White today. That's me. Our guest had emergency surgery to perform this morning, so we understand. Okay, education. You've heard the expressions, knowledge is power. It's true when it comes to maintaining good health. When it comes to the pharmacy, that means knowing that what medications you take, what they look like, and what conditioning they are treating. So, Brad, can you talk to our listeners about how Medicine Center Pharmacy can make that easier?
I can. And one last thing I want to hit before we do that, I want to just tell everybody about the price of our test strips. If you were listening at the commercial break, you heard our commercial for our Easy Max meter test strip pricing. But the test strips are less than $10, okay? So they are about $8 a box. So if you are testing your blood sugar and you're having trouble affording test strips, you need to call us at the Medicine Center so we can help get you an Easy Max meter. It's very affordable, very functional, and I promise you'll be pleased, guaranteed money back, okay? Okay, education. Knowledge is power, and I think that one of the things the pandemic has taught us that we've all been voracious learners and readers of everything going on. It's one of those things that I think we've really tried to be transparent with our patients and provide the best knowledge we can and help our staff understand what is important in the questions patients are asking. So, one of the things we can do for education is it's certainly helpful if you, the patient, have better access to pharmacy and our staff and to get the questions answered you need. And one of the ways you can do that is with our Medicine Center Pharmacy app right on your phone. We have a great app that you can look at all your medications. You can see pill images of what they look like with the little numbers on them and the colors. So if you're ever looking at your Easy Dose Pack and you're wondering which pill is the little blue one or the white one, you can open your Medicine Center Pharmacy app on your phone. You can look at your medication and see the image. You can also text our pharmacy staff in a HIPAA-secure fashion, and you can ask us questions, and we can respond to you over phone or text, whatever you prefer. So that's an opportunity. We have a number of programs on our website, educational programs that have been done in the past. They're all on our YouTube channel, and some are stored on our website, and some are here in Facebook and Facebook Live. So don't forget the opportunity to look for our Health Matters programs and look back and see, there's a lot of things that we talk about with a lot of different practitioners that really bring knowledge not only to us, the pharmacy, and the pharmacists that help answer your questions every day, but it can provide you maybe with some comfort if you're afraid of things. Like a couple weeks ago, we talked about colonoscopies. And I'm not sure anybody really wants to go have a colonoscopy, but it's really important for colon cancer awareness as one example. So we have literature in the pharmacies. We're going to have other seminars in the near future. So don't be afraid to reach out to us if you're looking for some resources. One other interesting thing about education, too, is I had a patient call me yesterday who's getting ready to retire, and they're going to go on Medicare, and they don't know where to start. We have a great tool we use at the pharmacy that we can look at all your medications, and we can plug them into the 28 or 29 Medicare D plans that are available in the state of Ohio, and we can help figure out which is the best premium cost and which medications are on formulary and covered, and try to give you an idea of which plan might be right for you. We don't necessarily make a recommendation for which plan, but we can show you the cost of the plans, the drugs they cover, and how it meshes with your current situation. So that's just a couple examples of some of the education we can be helpful in providing.
What about our lab testing programs? Have we resumed those?
We have. So we kind of are doing those on an appointment-only basis. There for a while before the pandemic, what we were doing is we were rotating Tuesdays in the pharmacies. And so like in Canton, the first Tuesday of the month, we'd have walk-ins. But now what we've done, and we've gotten really good responses, is the patients that are looking for a lab test, they can just schedule the appointment on our website or call the pharmacy or walk in, and we can make arrangements to do it for them then. It's helped us staff it much easier, and I think it's helped people who have different work schedules that Tuesdays were never really ideal for them.
Talk about, I think the A1C is very important. Talk about the A1C. I believe we're testing for that, and what the numbers should be, and normal numbers, I guess, and how often we should test.
The A1C is a great screening if you're a patient with diabetes. Generally, you get one every 3 months because basically what the A1C does is it gives you a snapshot into, if you want to, it's basically an average of what your blood sugar was over the last 3 months because it measures how much glucose was attached to a red blood cell. Red blood cells live about 3 months, and then they're replaced. And so when you measure the blood glucose that's attached to a red blood cell, it gives you a pretty good idea of what your average blood sugar is. So if you're in the habit of being really careful with your diet before you go to the doctor and they test your blood sugar and they see that it comes up at a really nice number on the spot, that's great, but the A1C is going to tell the truth of how good your diet and habits have been over the last 3 months. So, usually you want an A1C that is around 6 or 7 at the most. Any higher than that, you risk having both microvascular damage and, some wear and tear on eyes and heart and kidneys and things of that nature. So, there's a lot of medications out there that can help you manage that. There's a lot of dietary habits that can help you manage that. But it's a great test. We can do it in the pharmacy. It's really easy and simple. It takes about 5 minutes to run the test, and then you get the results real time right there. So it's really super convenient.
So, tip number 8, know your pharmacist. Do you know your pharmacist by name? We think it's important. To know our customers by name and develop a relationship so that we feel free to call they feel free to call any time and ask your pharmacist whatever health question is on your mind, and particularly about your meds. We think that all the meds that you take should be purchased at one pharmacy, so we have the computer records to understand your question, evaluate your question, all that sort of thing. So what other benefits can you derive from knowing your pharmacist?
I think knowing your pharmacist is as important as knowing your doctor. And frankly, speaking of knowing your doctor too, we have a lot of patients in the pharmacy right now that come in that don't have a primary care physician. And I would encourage you to do some homework in the community, or even ask us at the pharmacy and see if we can't help you find a primary care physician. You really shouldn't have to rely on stat care and the hospital and things of that nature. Frankly, it's going to be a lot more expensive for you, the patient, to get care in that fashion versus having a primary care physician. But to know your pharmacist, one thing that I believe is important to patients is they like to see the same patient or the same people in the pharmacy month in, month out when they come in and pick up their medications. You build that layer of trust. And I think when you have an uncomfortable question to ask, whether it be about this weird spot that's on your arm, or maybe something more personal that you just don't want to walk into a medical facility and bare your soul to, I think it's really important that you're able to maintain that level of trust and compassion, if you will. So I think that's really important. And the other thing is, too, we've seen patients in the pharmacy where if something's going on with their health and they don't seem like themselves, we can kind of be that impartial check to kind of check in with them and see if everything's okay. We've had some patients in the pharmacy sometimes that maybe they're having a really high blood sugar and they just don't seem themselves, and we're able to kind of have a conversation and see if we can't get to the root of the problem. And that's been a rewarding experience to help someone keep them safe so that they aren't injured.
Some of the stat cares do have regular physicians and regular patients, and offer regular visits. Is that true? I'm hearing that from some of the people that come into our stores.
I know that the stat cares and the urgent cares are being staffed with nurse practitioners, and some are seeing patients for services like our lab tests that we do. So, if you need a lipid panel or whatnot, or a COVID test, you can go to one of those. I think that what you're seeing is that healthcare continues to change. And whether you use an app on your phone to talk to a telemedicine specialist, or you use an urgent care instead of going to the ER for a situation like maybe a strep throat or something, there are certainly ways that you can get care in a more affordable way, and I think that's an important thing to remember. So, we're going to talk about it in our next tip, so maybe I'll leave it for that, but don't overlook the fact that having a doctor that knows you, it is certainly an advantage. Several of our staff members have utilized telemed, and they've been satisfied with the results. And it's a time saver, and et cetera, et cetera. They don't have to go wait in an office. It's pretty immediate the way I get it. So, yeah, and I think it's interesting because there's certain things that there's a protocol that can be evaluated with some simple questions and some symptoms and some feedback from the patient. And it's nice that you don't have to go sit in an office for an hour and pay $100 when maybe a 15-minute phone conversation with a video consult was appropriate. So it is an interesting dynamic, and hopefully it helps people get more access to care.
Okay, we'll take our final break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, Pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hundreds of new items have arrived at the Half Off and Out Buy store in Louisville. How about over 700 watches to choose from? All readers and sunglasses are reduced to $1.69 each. Values to $20 and above. Memory foam pillows, canning supplies, lawn mowers, massage chairs, and lots of new toys. Lasco box fans, Utz chips, coffee K-cups, 4 for 99 cents, and many varieties. The Half Off and Out Buy store in Louisville, next to the Medicine Center Pharmacy, and see us on Facebook.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Hey, we're back. And welcome back to Health Matters with the Medicine Center Pharmacy for our final segment today. I'm talking about tips, healthcare tips. Number 9, make it affordable. We all know healthcare and prescriptions can be expensive, but you may not know that sometimes we can help make it affordable. So what do you suggest, Brad?
Well, there's a couple things we can do. If you are a patient that is looking for more affordable medications, depending on your coverage and your age, there's a number of things. So if you're a patient that is not on Medicare, you know, there are a number of generic medications available that we could help consult with you on. A lot of times your physician and provider believes that they pick the best medication for you based on the symptoms and the situation you're having. And to their credit, they're not always aware of how expensive some things can be. So we can help work with you and the provider in kind of our triangle, we call it the triad, to work together to find you an affordable solution if it turns out to be really expensive. So that's one way. The other way is there are a lot of manufacturer discount or coupon cards available from the manufacturers that make the medication. And these are probably most popular with medications that are not available generically. Think insulins or asthma inhalers or brand name medications that you see a lot of TV commercials for. So there is probably a manufacturer support plan available for those if you need some help, because they are often very expensive. The other thing we can do is like I mentioned earlier in the program, you know, if you're a patient on Medicare, we can certainly help you look at your drug list and help make some therapeutic changes within the drug classes to help you find a more cost-effective product or a drug that is on the drug list, or what we call the drug formulary, for your particular Medicare plan. So those are a couple things we can do. We can also help recommend some nutrition or some lab tests, like the tests we do in the pharmacy, to save you some money over what you'd pay on the economy out in the marketplace, if you will. Those are just a couple things, but I would recommend overall that if you're not currently taking advantage of generic medications and you're leery, you have a talk with one of our pharmacists. It's something that can save you an enormous amount of money, and that way you can use that money for other places in your life.
Interesting. So, number 10, tip to enjoy life. We hope that making your life easier at the pharmacy will contribute to your overall happiness and well-being. We appreciate you and wish you a good health today and every day. And just a simple conversation with the pharmacist or with a staff member in one of our stores can help you celebrate the day better. We have a lot of long-term employees working for us, some in 20 years, some longer, and they're very knowledgeable on healthcare and how just a simple conversation with them might help you get through the day. So, what do you think, Brett?
Well, I hope if the listeners remember one thing about our pharmacy show today, I guess I hope that they would take away that they can take an active role in their health and wellness. And while there's a lot of tools out there to take advantage of, maybe they just need to have that conversation with a pharmacist or one of our pharmacy staff to figure out how exactly to make that happen. What is it that you would hope people take away?
Right now, we've undergone a full year, actually, and more, being sequestered in our houses for the most part. And I know a lot of people who haven't been out of their house. And I'm thinking, folks, come on here. If nothing else, you need to take a walk. You need to walk around the neighborhood or make some phone calls or see if you can help your neighbor. Wear a mask. We're going to be wearing masks, I guess, for a lot longer here, the way things are looking. And things along that line, including the conversation with your pharmacist. It's been a tough year and a half or year point whatever it is, and I think things are going to level off here pretty quick. So, excuse me.
Well, the weather's certainly turning. So yeah. You're right. Get outside, enjoy the sunshine today. It's a little cool today, but we got some nicer weather coming up next week.
There's some big temperatures coming next week. They're going into the 80s, so I'm hearing. So it'll be a shock. Don't put your winter coat on next week, okay? Because some of us are still wearing winter coats because the last couple of days have been really cold. So anyway, I think that's the best part of all of our tips. What else do you have, Brian?
I think just in closing, I would say don't underestimate the value that a community pharmacy can offer for you. We've been very, very proud to be able to participate in providing COVID vaccines for patients. We enjoy the opportunity to talk with you, to provide vaccinations, to provide solutions like, easy dose packs for complex medication regimens, or making diabetes care more affordable. Or, one thing we didn't talk about today is that we also can prepare custom medications in our compounding lab in New Philadelphia, Ohio, for solutions that aren't available by big drug companies. So whether you have a child that has a seizure disorder or a chihuahua that has some type of medical condition that they don't make a prescription for, we can help you. So don't be afraid to ask us questions, because we'll do our best to find an answer for you.
And the compounding is not only available in New Philadelphia, it's available at all of our stores. The New Philadelphia store is the certified compounding center that preps up some of this stuff. So I guess it's time to go today, folks, and we're glad that you listened to us, and we hope you have a healthy day. We remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. We said earlier, we're celebrating our 10th year on WHBC. And have a healthy week. And we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.